Brandon.
Hey.
Good to see you.
Morning. Yeah, it's been a long week.
It has. Well, I'm excited for this episode today. Yeah. You know, we did some prep before we wanted to get started today, and I think a topic a lot of employers right now, they're hearing about from people, they're reading online, they're seeing videos, and probably they're being told by their current broker, is around product knowledge. Specifically, things around stop loss, captives, third-party administrators, pharmacy benefit managers, different types of stop loss consortiums. There's a lot of stuff out there. So I don't know. I figured we'd spend some time on that today. Anything you want to make sure we use our time for today?
Yeah, no, those are all good things. And, like you said, there's point solutions flooding the healthcare space, not just from an end user standpoint, technology, direct primary care, apps, tools, navigation, coordination. There's so many things out there today, and it's hard to really understand, what is a good value, but then understanding, and what we're seeing a lot of times is how employees are actually engaging them. How are you actually getting the right ROI on all these different things? And I always think about it kind of two different ways, right? It starts kind of high level. What's behind the scenes? What's running the plan? What are the options there? But then from an end user standpoint, what's the experience? And everyone today is feeling a little bit of this. The end user, you're getting a little bit overwhelmed from how fast healthcare is changing. And there's a lot of good things happening. There's a lot of programs, there's a lot of strategies that employees are actually benefiting from and plans are benefiting from. And we're going to talk about this more in another episode soon, but really talk about how leadership teams can provoke that and guide that. But I think it's great to kind of let's maybe start top down. What's happening behind the scenes? What people that are managing benefit programs, what their options are, what they're looking at, what we're seeing. And then we'll kind of go through all the way down to the user experience, if that works for you.
Yeah, I think that sounds good. And maybe start with the thing people are most familiar with, the network.
Yeah.
How employees go and see and access care. There's a lot of different options here when you're looking at a network, and it depends on your area, your state, your city, on exactly what networks are most competitive. And employers should know there are now tools out there in the marketplace that take the carriers, take the TPAs, take the networks out of it. And all of the networks information, it's public knowledge now through transparency. And there are tools now where you can compare different networks for your employees in different regions across the country to see exactly which network is most competitive and best for your employees. Some may be the broad national networks that I'm sure a lot of us are familiar with. Some may be more niche, narrow-focused networks that actually have a broader footprint in certain regions, and they get better pricing at different facilities. So yes, networks, they're still extremely important because your employees need to go see the doctor, get care. But also, it's good to understand that maybe just using one network that you're familiar with, that you've known forever, and that you see on the news often, maybe they're not the best option. So just be curious there. And I'd be curious on what your thoughts are around networks nationally and what's happening in that space.
Yeah, and everyone's familiar with the big names. Everyone's familiar with the big national networks. And if you're a multi-state, national employer, you need that. You got to have it. It's kind of a nature of the beast. But we're also seeing history kind of repeat itself, where you're seeing these either state, regional, or local networks with facilities start to come back and be more competitive from a pricing standpoint. A lot of times it's really hard for a smaller employer in an area to understand that, why do I need to pay so much for a large national network when all my employees are in a 50-mile radius? Well, the truth is you probably don't, but the hurdle is a lot of these things are really restrained geographically by city, geographically by state. But what employers can do is really be educated. What are the options? What are the options locally? There's some great states, especially in the Midwest, that are doing some awesome things from a regional network standpoint. We're seeing that continue to grow. We're seeing some great partners in that area that are taking those to other states, and they're growing pretty rapidly. It's still a foreign concept for many employers. And it's really hard to even think about a world where we get away from the large national PPO networks being kind of a one-size-fits-all, everyone leveraging them, everyone asking for, one of the big three or the big four, to really start to go back to where we were years ago before that and go to a more localized healthcare system. There's some great examples of this happening. We're seeing them out there. You see them on social media, and kudos to all the advisors that have really built an entire livelihood out of this. And they're impacting people, and they're helping local employers, and they're working within these areas. What I'm excited to see is how these things continue to span geographically, because in my mind, that's the big hurdle today, is that it really depends on where your employees are of being able to access and leverage some of these things. So the number one thing an employer can do is just be curious, is what options do we have outside of the big three, big four names that we all know, and do a great job when they're needed.
And the biggest issue, like you mentioned, with networks right now is, what if you're a company and you have employees in 30 states? Yes, local networks that may be more competitive, but you don't want to be running 30 different health plans for your employees. So networks are evolving. Just as Brandon mentioned, be curious, learn, get educated. More things are coming out. I think the second organization that makes up the healthcare ecosystem that we should spend time on today is the TPA, the third-party administrator, because a lot of times individuals get these confused with the network. And sometimes the TPAs, they are owned by the network. But I'd be curious, what are you seeing nationally with TPAs? Where are employers winning, and where are some losing with a TPA?
Yeah, and this is really interesting, because I think at least, in the 10 years that I've been working with employers around, how to build healthcare ecosystems, the TPA gets usually the least amount of focus. Today, I would say what we're seeing is employers and health plans in general are starting to put more and more focus on the TPA due to the interaction from employees. What we do know is flexibility. It really depends on the TPA. And that goes back to the conversation earlier of when you start building a program and employees start engaging with it, what are they engaging with? And who are they engaging with? And the third-party administrator, they don't just pay claims. A third-party administrator that just does the blocking, the tackling, they pay claims, they adjudicate claims, they review large claims sometimes. That is really a thing of the past. And what we're seeing today is this transition, I would say, focus from TPAs, focused on those things, that's playing stakes now, to really being, how can the TPA be the conduit for a high-performing healthcare plan? And a lot of that comes down to flexibility, transparency, strategy from their end, and then their team, the people side of it. What do they have internally that they can help you build? What do they have from a clinical standpoint, from a program standpoint with infusions and J-codes and all these different tools that we're seeing TPAs now really be the center point of how those get utilized. And if an employee isn't extremely comfortable with their TPA and how they can help them, we typically are seeing these programs and solutions fall flat. So again, part of it goes back from that, high level, behind the scenes, the low level, and now you're dipping into with the TPA and employees interacting with that third-party administrator. How can you find and work with the right TPAs? And there's many of them out there that are doing a great job. How do you find and vet those options to ensure it's a good fit for what kind of plan you're going to build? And it goes back to, some of this is regionalized, some of it's localized, but ultimately what we're firm believers in when it comes to TPAs is finding one that is privately held, they're transparent in how they're being compensated, and they're willing to be flexible. If we find those three things in a TPA partner, we typically are seeing them be the ones that employers are extremely happy with and employees are extremely happy with, because their focus is on the patient.
Completely agree. And something employers, I think, do often is they'll say, hey, I want to start to slowly break apart my healthcare ecosystem. I've heard about self-funding. I've heard about getting away from being fully insured and working with one of the big carriers. So I still want a network, as we talked about, using one of the big carriers as my network so employees can access care. But a TPA, I think I want to step into using a different TPA. So I'm going to use a TPA that's owned by one of the big carriers. And I think this will be a step in the right direction. What we found is, yes, in the right situations, that may be a fit, and just ensure that you're doing the due diligence, right, to make sure that works for your organization. But the other side of that is you're really picking a program that's very similar to staying fully insured, because your TPA is also owned by your carrier, and it's going to operate very similar to if you still were fully insured. Those incentives won't be fully aligned with you as the employer. It's not going to be 100% transparent. You're not going to be able to see where every dollar of your program is going. And if you're okay with that as a stepping stone, that's great. Dive in and learn all you can before moving to one of those independent, privately held, fully transparent TPAs. Also, sometimes what we're seeing is employers may think that those large national publicly traded TPAs are easier and better for their employees. There's two sides to this as well. They pay claims faster. That's a fact. Are they checking those claims for accuracy, ensuring that those claims don't have any duplicate billings, that there's no errors in charges? Not as much as a private independent TPA is. An independent TPA, they're going to also serve as a concierge for your employees. They're going to help walk them through their healthcare journey and help them find the highest quality, lowest cost provider. There is a little bit more engagement coming from your employees using a privately held independent TPA. And like Brandon mentioned, it's all around, okay, where are we at today? What are we looking to accomplish? And what can we slowly implement to get there? So again, a lot of options when you're looking and exploring TPAs. There's not one that we believe that's a one size fits all and it works for everyone. You got to make sure you're doing your due diligence as an employer, looking at all your options and picking what is best for us, my company, my employees, and where we want to go long term.
And like everything in this space, it's something that's changing rapidly. We're seeing consolidation, we're seeing technology, we're seeing change in leadership, and I'm really excited for it because, again, the TPA is the first point of contact for an employee, and how they engage with the TPA is paramount in whatever the rest of the program is trying to accomplish. And really, what we're seeing is those TPAs that are flexible, but then are building integrations and growing and making it seamless for employees. That's really where I think groups are winning from an employee engagement standpoint. And ultimately, what we're seeing pop back up is basically these healthcare plans where you're building an ecosystem that is, at the end of the day, it's integrated with the right partners, that aligns with a group's risk appetite, that aligns with what they're trying to accomplish long term. It really is a focus on a health plan versus health insurance. So I'm really excited for this space. I think it's changing fast. I think competition is good with everything. And it's something that I think we're just seeing everyone kind of rise in this area. But it's an area that you constantly have to be looking at, vetting, and before you make any change, figuring out who's the right partner, because it is a key piece of the program. And it's not something that you do want to remove or change often, because it does create disruption with those changes.
Yeah.
Just thinking about that, Steve, kind of that first engagement point from a TPA perspective, so employee, has a claim, they engage with the TPA. Let's go kind of maybe jump back up a little bit higher level and talk a little bit from a program standpoint. So we've talked about network, we've talked about TPA. Let's talk just a little bit about what's happening in the stop loss and the captive space today. And everyone is hearing about these buzzwords. More groups that are middle market and lower middle market today are self-funded than ever before. I saw some data over the past 10 years where the amount of groups self-funded has actually stayed the same, but it's been more middle market groups have gone self-funded or to a partially self-funded program. Give us just the lay of the land, what's happening in the captive space, maybe just higher level. What is a captive? How does it work? What's it mean for an employer? And then what should a group be looking for as they're considering these things before they jump in?
Great question. And it's a loaded question because there's a lot of options. And we like to think about it, and how we educate employers on is think about a healthcare continuum, and think about $1 of healthcare, right, would be you're fully insured. You're spending $1 of healthcare. And as you slowly move down the healthcare continuum, healthcare costs become less and less expensive because you're buying a little bit differently. You can go from fully insured to level funded to bundled self-funded to unbundled self-funded with the protection of a captive or a consortium, to unbundled self-funded with no protection, standalone self-funded, even all the way down to reference-based pricing with no network using direct contracts. So there's a lot of different options here, but I think what a lot of employers are hearing about right now is captives. Captive, captive, captive. Loud and clear, similar to the network and the TPA. There are some really, really good captives out there, but there are also some bad captives that were set up poorly and that are running very similar to just staying fully insured. Yeah. The number one thing we see about a captive is, who are you pooling your risk with? So just know, if you're going to join a pool of employers, you're sharing risk. So how employer A runs is going to affect employer B's renewal. So you better make sure, if you're going to spend the money, there's an upfront cost to join a captive, and you're going to spend the time, right, to join, because we all know it takes hours of a leadership's time to join a captive, that you are being put in a pool with groups who are doing similar cost containment measures as you.
Yeah, and I think what we've seen when talking with potential clients, or even sometimes clients, is that they don't know really what they even signed up for. And they really don't know what they've engaged with. And it really starts in the due diligence phase, is being curious, learning, working with your broker, working with maybe peers, and understanding, hey, what are you all doing? What do you like? What don't you like? And hey, can you tell me a little bit about the strategy and the long-term strategy? Because what we're seeing is a captive isn't a solution. What is a solution is working with like-minded employers to manage risk, manage claims. That's what we're seeing with pooled risk programs where they're having success. And it's not always a captive. There's programs out there that we're huge fans of that aren't the captive structure. They still allow for risk pooling in the consortium space, but even to that point, there's different types. Nothing's a one-size-fits-all, and we're believers in that, but there are programs out there that employers can access that will match what they're looking to accomplish. This space is changing rapidly, and if you manage an employer healthcare program, it's one of the biggest impacts you can have if you're a CFO or in an HR seat. And being able to at least have the knowledge, or at least be curious to ask hard questions of the vendors you're looking at working with or the programs you're looking at joining, we see that to be the key when you're vetting these different tools that are part of a healthcare ecosystem. And ultimately, today within this space, there's more large claims than ever. We're seeing employers, and that's where the whole ecosystem comes together. You're seeing employers with, the network is how it's repricing. Then you're seeing the TPA, how are they managing large claims? What's their part of that? You're seeing, large pharmacy claims. The TPA is still the one that's going to, a lot of the time, be helping to coordinate these things. But ultimately, when you're buying that stop loss, understanding that's what's going to protect you when you have the $1 million claim. It's what's going to protect you when you have the ongoing high-cost drugs. So knowing if you're going to pool that in a captive or a consortium and have that stop loss coverage, understanding what your peers are doing as well to help mitigate some of that cost is key.
And when you think about how your dollars are broken up, think about them in two buckets: your fixed costs and your claims costs. Your fixed costs go to pay these partners in your ecosystem, the captive, the TPA, the network. And then your claims costs go to pay your employees' claims. When you're pooling risk with a bunch of other employers, your goal is to keep your fixed costs as low as possible. If your fixed costs are rising at 10, 15, 20% at trend annually, more money is going to pay vendors and less money is going to pay for actual claims. So, and I think we should close today with, Brandon, what you mentioned a lot is employers are used to buying health insurance. How do you build a healthcare program long term? I want to share one case study, then I'd love for you to end on that concept about building a healthcare program and what that means. We were working with an employer about 24 months ago. They were already self-funded and they thought they were doing everything right. They approached us because they had a high cost claim that was on their plan from 12 months ago. They were no longer on the plan and it was still impacting their renewal 12 months later. And they were confused. They had heard about us online. We had had a relationship with someone that knew them, so they got introduced to us. We had a conversation. And they had renewed. It was a tough renewal, and this claim from 12 months ago had impacted that renewal. And they were really confused. They didn't understand why. They thought stop loss was renewed on a look-forward basis, not on a prior risk to recoup those dollars. So we looked at their program, and it was set up poorly. We did a mid-year transition in May, 5 months after their program had already renewed, switched the stop loss carrier, and it saved their plan 30% through the rest of the year. Just by making one vendor change and making sure the stop loss program was set up correctly, this company saved 30%. Their TPA stayed the same, their network stayed the same, their pharmacy program stayed the same, their stop loss changed. And then what this tells us is stop loss programs are set up poorly all the time across the country. So just ensure as an employer you're doing your due diligence and that your program is set up exactly the way you want it to be set up to achieve your long-term goals. But Brandon, I'd love for you to talk about healthcare program versus health insurance, where it's been, where it's going. And I think that'd be a good wrap up for us.
Yeah, thanks for sharing that example. It's one that we've seen an iteration of over the last couple of years, and I think that is also part of more groups going to a self-funded environment. There's more mid-market groups that are interested in it, and there's more people learning, which kudos to them, but at the same time, not everyone has the experience to help these groups make these changes. So just ensure you're working with a partner that it can help you accomplish what you want to. And the last thing, we'll end on today, specifically healthcare versus health insurance. And a lot of people say, hey, I have my health insurance, and, they go to the doctor and they think of health insurance that way. Well, let's take one step above and go back to an employer plan. Employers today, especially if you're in a partially self-funded, any environment, you're running a healthcare plan. Yes, you do buy one piece of insurance that helps with large claims, but when you're looking at what's driving costs, it's healthcare events. So what we're really seeing a shift of, especially with leadership teams that are engaged, they're thinking long-term, especially ones with employees that have longer tenures, lower turnover, is really shifting the entire mindset of how are we getting our teams engaged with the programs we have? How are we getting our employees engaged clinically? And then what are we providing and what are we building to help that? What we see time and time again is all these different tools, all these different programs that employees either don't use, don't care about, or don't know about. Where we're seeing groups win are the ones that meet as a leadership team, understand that they have a healthcare plan, it matters to their employees. Having great benefits matters, but throughout the year, how is that engaged? And the position where we're at today is that, in our opinion, if you're a partially self-funded employer, you are running a healthcare program, and you should be looking at who are the people that are helping me build that? Do they know about healthcare? Do they have a pharmacy background? Do they understand what's driving claims costs? Anyone can go buy a health insurance plan. Anyone can go get a stop loss quote. Anybody can go get an RFP from a vendor. But when you're managing a healthcare program the other 12 months of the year, partnering with a team that can advise on those things, we're seeing to be paramount. So just what I would say to everybody that's sitting in a seat that's running an employer healthcare program is take the insurance hat off after renewal and really focus on how can we optimize a healthcare program, how can we focus on outcomes, our employees' ongoing clinical health, and then what's the long-term strategy for the healthcare plan. And putting that in writing, coming up with a plan as a team is key.